So I like to think of biologic or holistic dentistry as sort of the functional medicine of dentistry, right? Instead of kind of what's the problem and how can I fix it, it's more of what's the problem and what's the root cause.
Mhm.
So we're looking at so much more than just, are you flossing and are you eating sugar? Sure, those are important. But we are absolutely looking at, gut health, pH, airway, oral microbiome, um, habits and all kinds of other things. So that definitely distinguishes it. And for me, I ended up in this after I had my first kid. So I'm probably just like one of your clients, right? I had my first kid and then I felt terrible. I was like, I don't feel like myself again. What's going on? Which led me to discover functional medicine, and then from my functional medicine doctor, I actually learned about biologic dentistry. As a dentist, I didn't even know it existed. Um, and then as I learned about biologic dentistry, one of the first things I learned about was amalgams and the danger of mercury, not only, to my patients, but when we remove it, the danger to myself.
Yeah.
Um, and so I just launched, like, that was it for me. I couldn't go back.
When you're in your practice, when you're seeing a patient, which you're in Colorado, by the way, for
Yes.
everybody that's listening,
Yep.
what part of Colorado are you in?
In Fort Collins, about an hour north of Denver.
Okay. So when you're in your practice and you're seeing a patient, what is the biggest difference, from an intake and experience standpoint when someone's coming in to see you as a patient now versus before?
So that's actually for patients, I think, a very stark difference. Typically what people are used to is you have your appointment with a hygienist, you get your teeth cleaned, and the dentist pops in and talks to you for maybe like 10 minutes.
Yeah.
When you come as a new patient in our office, you actually spend 2 hours with us the first visit. And that is, we're taking a full dental and medical history. We are doing full set of x-rays. We're doing a 3D x-ray, which shows us a lot of things we miss on 2D, photos, full exam. And then after that, typically, I take all that information, I sit down with it for about an hour to figure out and start to tie the pieces together. I see a lot of people who have autoimmunity and other chronic health conditions. And so we're trying to put together, like, is there an infection that's impacting things? Is there, gut health? Do we need to recruit a functional provider in to get that bigger picture? It's not just, hi, Brooke, nice to meet you. You have two cavities. I'll see you next week. And here's some fluoride, right? Like
Yeah.
it's a very different experience.
Okay. I love that. And speaking of fluoride,
Yes.
I get this conversation all the time. We took it out of our toothpaste years ago, especially once I developed hypothyroid. So 9, 10 years ago, I stopped using it. And there is a lot of controversy around fluoride, whether you should use it, not use it, and especially having two young kids. We still don't use it in our kids' toothpaste either. Can you break that down, like the history of fluoride, like why it was even brought in the first place, and like why we don't use it now?
Yeah. Well, a lot of people still use it, but it was discovered actually in Colorado Springs. There was an area in the Springs where people had these very like mottled teeth, what we call fluorosis, but the dentists noticed that they had lower risk of cavities. So all of that sort of led to, oh, it's the fluoride in the water naturally that is causing, this lower incidence of cavities. And then we started fluoridating water and putting fluoride in toothpaste and doing all of that. More current research is not as supportive of that. So I can tell you, even just anecdotally as a dentist, the patients I see who have that fluorosis, they still have decay. What's tricky is you don't see it in an x-ray. So the unfortunate part with that is it's like you don't think they have a cavity, and then it's literally almost to the nerve by the time we can see it. Um, Fluoride itself, the thing that made the most sense to me as a dentist and like the science part of my brain was when I realized how bad it is for that thyroid, right? Our thyroid needs iodine.
Yeah,
Fluoride is a stronger molecule than iodine, so it's constantly displacing it.
yeah.
Um, and then the most recent research, if you want to look at it or anyone wants to look at it, the International Academy of Oral Medicine and Toxicology, IAOMT, they're doing a lot of education right now because we've realized that it's actually a neurotoxin to children. So I don't give it to my children either. And the crazy part is we have two forms that we give fluoride, right? We use it topically, that's in our toothpaste. That actually is probably less damaging because you're spitting most of it out.
Yeah.
And actually, if we want to look at the science of does fluoride work, topically, it works okay.
Yeah.
Having it in our water doesn't actually work very well on the teeth at all. Like past development, it doesn't work. So why are adults having it? Why are children having it? Um, and so, yeah, I would seriously, because we don't do it. We don't recommend it. Definitely not if you have a thyroid condition.
we always recommend filtering it, making sure you have a filter that filters fluoride out. There's a lot of people who will say like, well, I filtered water. And when they go check, their filtered water is not actually filtering a whole lot, especially not fluoride. So if you're listening, you definitely want to look into your filter to see if
Right.
it's in it.